And you're mentioning the risk factors too. I mean, we do know that red-haired, light-colored skin, blue eyes, green eyes, fair skin, those are all risk factors for having a higher incidence of skin cancers. And there's other factors as well. A family history of skin cancer. If you smoke, you know, you're already getting a carcinogen and that's affecting your DNA. That does kind of fit with the double hit theory of a cancer forming. If you have a previous history of radiation, for example, somebody who had breast cancer and had radiation to an area, they're more at risk for skin cancers in that area. As a former flight attendant, every time you flew in the plane, you got a little bit more radiation than getting an x-ray.
Right.
So all those multiple trips, you have a lot of UV exposure that people don't really think about. Those frequent flyers and the pilots and the flight attendants are at greater risk. Some other risk factors are if people live by manufacturing or chemical areas. That's an additional risk factor. Can you think of any else that I left off? There's probably a few
outdoor
more
occupational, recreational,
yeah.
golfing, tennis. Those are a lot of times that those people will have a significant increase and increased likelihood of having problems as well.
Okay, and that's because they're exposed?
They're out there more.
Yeah, a little bit more. I know my husband loves to golf, but now he wears all the protection.
All right.
Wears the hats.
Good. Well, we don't want people to go live in a cave. We
No.
don't either.
Yeah.
But you just have to protect your skin while you're out there enjoying our Minnesota winter when we have nice weather.
Yeah, exactly. You know, just a little bit of protection when you get out of the shower. Instead of putting regular lotion on, maybe just put your sunscreen on. You know, because it does both.
Yeah.
You know, moisturizes and also, you know, protects. So what a great idea. Yeah. But I love the idea with the babies, you know, because she was so fair that I had to cover her up all the time. And, you know, red hair and blue eyes. And so there was always that, you know, sunscreen getting put on, and now they've even improved that, and with the actual baby scent and a lot of really beneficial things that they are now coming out with that they didn't used to have. So we are evolving in a good way.
Yes.
So that's great. Okay. So I basically want to talk about the sun damage, the solar eclipse, or the photoaging. If you want to talk a little bit about that, as you mentioned, the golfers being outside, the tennis players being a little bit outside, those who do go out on their boats, you know, down on the rivers that are the 10,000 lakes of Minnesota that we have. So you can talk a little bit about that.
Well, being outside and being on the water, as well as being outside in the snow, you get reflected rays, so you're getting more of an exposure. It just increases your risk, and you just have to watch out for that.
Okay.
You know, in talking about solar elastosis or sun damage, some of the same treatments that we do, as you pointed out with your husband's treatment, that treated the precancerous lesion also treat some of the sun damage. I had mentioned the chemotherapy in a cream.
Sure.
There's another cream that stimulates our immune system to rev up and fight and remove the abnormal lesion. Advanced dermatology care, we have a treatment called photodynamic therapy.
Okay.
It's sometimes nicknamed the blue light treatment.
Okay.
And it's another selective treatment where the person comes in and we apply this medicine and we let it soak in.
Okay.
And it's preferentially absorbed by the abnormal cells. And then we put you under this blue light. It's a specific wavelength of blue light, and that activates the medicine and it kills the abnormal cells. And so it's the advantage of that versus the creams. Instead of 1 to 2 months of having those spots light up and looking terrible, you kind of look terrible for 2 weeks instead. So it's a little faster. But it is also nice in that it's killing the abnormal cells that are, of course, going to continue to divide and show the signs of photoaging, as well as go on to become precancerous as well. There's other treatments for photoaging that are not usually covered by insurance. We have a large part of our practice that's called cosmetic dermatology, and it's called that because sometimes people think we're talking about applying cosmetics, and that's not really it. But if the insurance companies deem that a treatment is medically unnecessary or not warranted, then they don't pay, and so then it's considered a cosmetic treatment. And we do have many that really work on photoaging, because by reducing that, you can really make the skin healthier and look a lot better and stimulate collagen and elastin, and those are all things that we want in our skin.
And then you stop it right there. It doesn't spread anymore or go on, and you can become invasive, right?
Right, if you have a precancerous lesion, yeah, definitely. I thought you were going to say sometimes patients want me to come and tell them how they can stop aging in their skin. And I always have to chuckle because as long as we're alive, we're going to continue to age.
Yeah.
But we just want our skin to be as healthy as possible.
Sure.
One of those treatments that we use a lot is our skin rejuvenation IPL laser. And that blanches a lot of those sun-induced brown spots, lenticels, melasma, as well as some of the superficial blood vessels we get on our skin with a lot of sun damage. And that's a nice treatment for that too. We also have chemical peels, and they help quite a bit in reducing the signs and the cells of sun damage. Microdermabrasion, and then we even have up to a Fraxel CO2 ablative laser that works with that too. That's quite a big procedure.
Wow. That's
And just as you mentioned, your husband looked better with the cream treatment. The photodynamic therapy that Dr. Ruth was talking about is also sometimes used by people just for purely cosmetic benefit. The stimulation of the collagen as it destroys the sun-damaged skin helps a lot with reversing that sun damage, and then they can get a more youthful look to their skin as well.
Sure. Well, we can't stop aging, so
No.
unfortunately,
No.
but we can do it with grace.
Exactly.
Is
Absolutely.
what we're trying to do, you
Yeah.
know. Talking about aging, we want to talk a little bit about improving the health of the skin. You know, I mean, yes, we can do it gracefully, can't we? Age a little bit better and things like that. So I want you to kind of maybe tell our viewers how they can help themselves with any sun-damaged skin may occur because there wasn't any sunblock back when they were younger, or, you know, something on that line. That what can they do now that it's already happened?
I think first of all is to prevent further damage. And that's the sun protection we've been talking about, the sunscreen, the protective clothing. Because if you continue to damage your skin, it doesn't give your body the chance to heal it. So the first step would be to certainly stop any continuing damage. Certainly a healthy lifestyle, eating well, not smoking, all those things are very healthy for the skin and help it improve. And then certainly the medical benefits of the topical therapeutic creams we were talking about, that may be of some benefit, or the light treatments. And then there's the more cosmetic treatments that can be used, as Dr. Ruth also mentioned, the lasers and photodynamic and those sorts of things.
One of the other things that I like to get my patients on is using a retinoid. Now, if somebody has acne, and some adults still do, often that's covered by the insurance, using a medicine like Differin, Retin-A, Tazorac, Finacea, and there are some other brands, Atrilin, some other ones that aren't covered by insurance that are just used by people for cosmetic reasons. We found out probably about 20, 30 years ago that Retin-A actually is the wrinkle cream because it stimulates collagen and elastin. So don't despair if you have a few pimples, because you can get a good medicine that will help both the acne as well as increasing the strength and collagen and elastin of your skin. It is a medicine that I like to have my patients use because even if they don't have acne, there's some really good retinoids to use for that. It's a medicine that's been proven to actually stop one of the enzymes in the aging cycle that breaks down some of the collagen and elastin and produces superoxidase, and so it kind of breaks down a little bit of part of that vicious cycle that will continue to age our skin. As our skin, as we get older, our skin gets thinner. The epidermis, the dead skin cell layer, actually gets thicker because we don't shed those as normally. And the dermis, the middle part of the skin, gets thinner. So those superficial blood vessels show more, our skin gets more fragile, and with the dead skin cells, it kind of produces a little more of a dulled appearance. And the retinoids reverse that. They help slough off those dead skin cells, and they help make the dermis thicker and more resilient.
Wow.
So,
well, that sounds perfect. You get 2 in 1.
Yeah, it's really a nice treatment.
But I'm afraid we've run out of time. So I'd like to invite you back.
Oh, that'd be great.
Oh, yes.
Thanks. This was nice.
It was fabulous. So,
Thank you.
Yes, thank you. Okay. Well, I hope we have provided you with more information for you and your loved ones, and I look forward to having you view other shows of Knowledge for Wellness. And until next time, be well. Thank you.